Hello, I'm Dr. Karim Kurji, your Regent's Medical Officer of Health. We are still having challenges controlling the outbreaks in our long-term care homes and congregate living spaces, where two-thirds of our deaths are occurring. The income supports and the pandemic pay that the province has announced will certainly help. I'd like to point out that south of us, there are challenges with respect to outbreaks in shelters. Many of the individuals there are asymptomatic. Together with our hospital partners and EMS, we are progressing to test our homes and shelters. Given that this virus cannot be underestimated, I would ask that we remain vigilant with respect to our good hygiene habits, respiratory etiquette, disinfecting, maintaining safe distances, and staying at home except for essential visits. I'd like to point out that 1 in 5 of individuals over the age of 70 who is tested positive happens to die. So very important for elderly folks to remain at home and get their friends and neighbors to do the essential tasks, but keep your distance. However, there are signs of optimism here. The doubling time, which is the time it takes cases to double, is about 14 days, and this is very good in comparison to other jurisdictions. The cumulative cases graph also appears to be flattening. The number of new cases we see a day seems to be going down, but periodically there are unwelcome spikes. Our website, york.ca/COVID-19, is updated at 5 p.m. every day. On this website, you will find the up-to-date details on clusters and outbreaks that we have. Information management is a challenge for all of us. I'd like to remind you about the National Immunization Week. Should you have children who have missed on their immunizations, please connect with your healthcare providers as there are catch-up schedules that are available. I'd also like to remind you that if you happen to have a known COVID-19-like emergency, please do not delay going to the emergency department, because then the outcomes for everybody concerned is bad. Finally, remember, if you have COVID-19-like symptoms, please self-isolate. Get your close contacts to self-isolate, and then seek out assessment at one of the 3 assessment centers we have in the region. We are told by Malcolm Stouffville Hospital that they have ample capacity to test, so if you can go there, that would certainly be very helpful. Thank you, and please stay vigilant. Bye for now.